NAMI Maryland 39th Annual Conference. My name is Gertie Wilson, and I am a volunteer with NAMI Maryland. I will be your moderator for this session today. This workshop session is Conflict Resolution Skills for Self-Advocacy, presented by Dan Berstein from Mediate. You can read more about our amazing presenters, including their full bio in the digital conference program on the official conference website. What are the best ways to ask organizations to change their processes to accommodate a mental illness or to respond to stereotypes, microaggressions, and discrimination? This workshop teaches conflict resolution skills to help using case study examples. Participants can access free takeaway tools. If this is not the workshop you meant to attend, please click the back button on your browser or click on the conference drop-down on the left-hand side of your screen and select Sessions from the menu to return to the full list of workshops we have available. We will be addressing questions at the end of this presentation, but I'm gonna jump in there and let you know that Dan will let you know how to do the questions. If you have any questions as the presenter continues, please post them to the social wall on the right-hand side of your screen. We will be reviewing questions as they come in, and if something is in particular is unclear or need to be expanded, we will ask our presenter after their presentation has concluded. If you have any comments, concerns, or technical issues, please post them to our social wall and our technical assistant will address them accordingly. When posting on the social wall, please be aware that there is a 20 to 30-second delay between the presentation and the stream on Conference Tracker. When this workshop session closes, you will be prompted to fill out a brief survey. If you would like to receive CEUs for this workshop, you must complete this survey in order to qualify. I'd now like to welcome our presenter for today's workshop, Dan Berstein. Thank you so much for joining us today.
Thank you, Gertie, and thank you, Mitchell, for your help on the tech side as we do today's presentation. So again, the workshop is Conflict Resolution Skills for Self-Advocacy, and my name is Dan Berstein. And here is a brief introduction to me. So my work in general focuses on helping people have difficult mental health conversations. I'm a mediator with bipolar disorder, and I do work creating tools to help people have these conversations. So today, I'm going to share a lot of skills with you, and also I'm going to link those skills to tools that can help you. And after the conference, I will reach out to NAMI and ask them to send you the tools that I'm showing you today. So you'll be able to have access to those tools. You can also email me, and I'm going to show you my email address at the very end of the presentation, but dan@mhmediate.com. This is my life's work. This is my passion. If you ever want to connect with me or you have any questions, email me at dan@mhmediate.com. And again, I'll show you that at the end. So today, I'm going to introduce this idea of self-advocacy with using conflict resolution skills. And then I'm going to teach you some conflict resolution tools. I'm going to talk about how we can share needs, sensitivities, and boundaries. I'm going to talk about ways we can request a reasonable accommodation, which is asking for a change that a business or an employer can provide us based on having a disability from a mental health problem. I'm going to briefly talk about how we seek information, and then I'm going to also share some information about confronting microaggressions and instances of discrimination. So the whole theme of what we're talking about today is figuring out how to use these conflict resolution tools to get what you want. So our introduction here is I want to introduce this idea of mental health assertiveness. And these are skills to know what you want. So figure out what it is that, that's the first part, is to know what you want and then know how to seek it in an effective way. And that's what I'm defining today as, using conflict resolution for self-advocacy. So what might you be assertive about? Well, you might be assertive about decisions that you want to make. adjustments that you need, and that's where we talk about the reasonable accommodations, and stigma that you don't believe is appropriate and you don't want to endure. And so you want to talk about how to deal with stigma. So when we look at decisions, we might have decisions about our communication. What conversations do we want to have or not want to have? How do we want to have them? What language are we using? When are we having them? Those are all choices that we might make. Those are all boundaries that we might share. We might have lifestyle choices, anything about our lives, who we date, where we live, what we want to do with our time. All of these are decisions that we might make, and we might want to be assertive about that. We might have boundaries about that. We have decisions about treatment. If you have a mental health situation, do you see it as a mental health problem? What kind of treatment professional do you go to? Do you go for a second opinion? Do you follow their exact recommendation or suggest other options that you want? All of these are choices. So the idea here is we're looking at the world as there's decisions we can speak up about. Sensitivities, what are the things that bother us? What are the things that we don't want to be around? Again, that's boundaries. We might look at living situations. If we are living with someone, whether it's our parents or our family or a roommate or a friend or a romantic partner, what do we want that living situation to look like? So you can see there's a lot of different choices that we might end up being assertive about and speaking up. And the important thing is that when we have all these decisions, we could have conflicts about them. And so having conflict resolution tools, which I'm going to show you about in a moment, can help us in speaking up and making our decisions and working through these conflicts. Now, the next thing we might look at are adjustments. Now, what do I mean by adjustments? Well, I'll introduce it later, but people who have a diagnosed mental illness that is serious enough to cause some kind of limitation in their life might qualify as having a disability. And if you have a disability, you have the right to ask for someone to change their normal practices to help you access their services. And I'll talk more about that later. But those are the kinds of adjustments we might ask for legally. And we also might just ask for adjustments without using our Americans with Disabilities Act rights. And we might make those adjustments at work, at school, in public businesses that we go to that they're not our employer, they're not our school, but they are open to the public, and they also are required to make adjustments as long as those adjustments are reasonable. And so we talked about decisions, we talked about adjustments. When else might we self-advocate or be assertive? We might self-advocate or be assertive when we see stigma. So stigma might happen in the form of microaggressions, which are comments that may seem nice and they might be well-meaning, but they have denigrating messages that make you feel like the person sees you differently. So one example I always share is when I was training as a mediator, people didn't know I had bipolar disorder, and I started being open, and one of my friends who was another mediator said, "Oh, wow, you have bipolar disorder? Wow, you're doing so well." And he meant that nicely, but the way he spoke it implied that he was looking at me in a paternalistic way that put me down. And so that's one example of many kinds of microaggressions. And the question is, when somebody talks to you that way and you feel stigma, what do you do? Would you speak up? So we'll talk about that today. And there's discrimination. Discrimination is more than just a comment that someone makes. Discrimination is if someone treats you differently, directly does something to treat you differently in order to, or not in order, but because of the fact that they believe that you have a mental health difference. And so if somebody excludes you from a program or gives you a different kind of service because they're avoiding you because they have stigma to a mental illness, that's discrimination. So this has been a roundup of some of the situations we might be in where we would want to use conflict resolution skills and self-advocate. So I'm going to go back to the agenda. And at this point, I'm going to encourage everybody throughout the presentation, if you have any questions, please put them on the social wall and Mitchell will relay them to me. There will be a delay as to when I see the questions because of the way that the streaming works with the conference tracker, but I will look at the questions. I've got the chat box up with Mitchell, and I will watch to see what's coming in and try to address them. And I would appreciate it if people do have questions to share them, because I think that that's important, and I want to be responsive to whatever questions you have. We'll also leave time for questions at the end. We started a little late, so if I have to skip over some parts of this program to get to that end question time, I'll do that. And again, I'm going to share all the tools with you afterwards by reaching out with NAMI Maryland and asking them to forward a link to you that will have all the tools I'm about to show you. So you'll be able to get any information that way, even if it turns out we don't have time. I'm a fast talker normally. I don't want to talk even faster just to make up for the time and then lose people. And if anyone is feeling like this is going too fast, you can also tell that to Mitchell, and I'll pay attention to that in the chat too. So apologies if this is going extra fast. You know, I'm trying to keep it at a reasonable pace and still make sure we cover all the material. So now let me show you some conflict resolution tools that you can use in any situation in your life before we go to some of these specific situations on the agenda. And the first tool is listening skills. So listening is the first step to resolving a conflict with another person, because once the other person feels like you are hearing what they have to say, they're more receptive to listening to what you have to say. And once you listen to the other person, you're in a position to know the information you might need to work with them to come up to some kind of agreement. So the first thing you do in a conflict is listen. And when you listen, what you want to do is validate someone's perspective. When you validate their perspective, you are not agreeing with their beliefs, but you're agreeing that they have a right to form their own beliefs. So you're saying, I hear you and I accept what you're saying. The best example I like to give of what it looks like when someone isn't validating happened to me during my first hospitalization for bipolar disorder. I told a nurse my future plans of what I was planning to do when I left the hospital. And I said, what do you think, Sam? And Sam turned to me and he said, with a big grin on his face, I think you're manic, and walked right away. So he didn't care what I had to say. That is invalidating. Validating someone's perspective means listening to them and acknowledging that you hear them. There's some tools that you can use to do this. I'm trying to give you an overview of lots of tools today. So I'm not going to go in depth teaching about validating someone's perspective, but I'm going to share some of those tools with you afterwards. And so you'll be able to see them. And one of the tools is reflective listening. Reflective listening means repeating what the other person said back to them, to check to make sure you heard them correctly, to give them an opportunity so they can hear what they just said and maybe they want to correct themselves, and just to show them that you really care and are trying to listen to them. So one tool that I'm going to share with you is a reflective listening tip sheet. This tip sheet teaches you some of the steps for effective listening, tells you how to do a reflection, helps you figure out what kinds of things to say back to the person, and helps you with some phrases to start your reflection. So that's the first tool that we have in conflict resolution, is listening. And these listening skills seem simple, but they are complicated to put into practice, because we're all human beings and we have an urgency. We want to talk about our own perspective first, or we think we're listening, but we're not. So it takes a lot of practice, and it's really helpful to have things like this tip sheet and work on your listening skills, with the understanding that if you do listen better, you're going to have an easier time in a conflict, because you're going to have more information about what the other person wants, and you're going to have built more rapport, because people really feel better when they feel heard, and it's less of a fight and they think that you're actually trying to listen to what they're saying. That can be difficult when you're upset with them, but if you can learn to do it, it can be very helpful. So the next skill we have, I'm going to call resolving conflicts. And again, I will share these tools with you, as well as training modules that you could access for free to learn these skills with the takeaway tools. When we talk about resolving conflicts, we go past that first step of listening, and now we're saying, okay, how do we understand and address the problem we're having? And when we do that, it's helpful to look at an iceberg metaphor for the conflict. And you have what you see above the surface, and that is what someone calls their positions, what you can see, what they're saying they want. So a good example that I like to give for positions is if you have two roommates and one person says to the other, we needed to be quiet after 10 p.m. That's my position. But you don't know why they want it. So the position is the specific expressed choice they made related to a decision. Their choice is, we're going to be quiet after 10 o'clock, but the needs, which are the bigger story, is why. Why do you want to be quiet after 10 o'clock? Well, there's a lot of possible reasons you might want to be quiet after 10 o'clock. It might be that you're trying to go to sleep then. It might be that you want the person to show you a sign of respect. It might be that that person is making noise after 10 o'clock that you don't like to hear, and it's the specific noise that's the problem. And it could be a lot of other things. So when you go past the positions and try to understand the needs, that's the information that you really need to have to resolve a conflict. The need is the person's underlying motivation or reason that led to that position. So again, we've got this positions and needs in the iceberg. And another tool that I'm going to share with you is this positions and needs worksheet. This also comes coupled with, if you want to practice this, a demonstration of how to go through specific scenarios and outline the positions and needs, which is a very powerful experience. Again, I'm not going into it in full depth here in this program because my goal here is to show you a lot of possible tools you can use for a lot of possible situations. And you can always contact me or use the resources I share to go more in depth to any one of them. So we've now done the listening skills, and we've learned about positions and needs to try to resolve a conflict. The last step is to try to reach an agreement. And so in order to build a good agreement, the first thing we do is listen and appreciate the person's positions. We use that tip sheet I just shared to do the reflective listening and find out what the person wants and show them that we're listening. And we appreciate them and we validate them with the skills that I talked about earlier. You try to avoid attaching any judgment, and you respect that they have their own choices of what they want to make in the situation. Then, after you've done that listening, you start uncovering their needs, which is the skill we just talked about. You ask them open-ended questions. Why do you want the thing you said you wanted? And you can use this worksheet to map out the needs, the positions and needs worksheet. Next, you want to brainstorm new collaborative choices together. So you're trying to work out a solution that meets everybody's needs. You try to think of everyone's needs. You remember there's no bad ideas. You just want to get as many ideas as possible. And you don't want to assess the ideas. You just want to keep coming up with those ideas. And finally, you reality check the agreement. This is the most important part. You want to make sure you agree to something that's actually going to work. I always give the example of two people who are in a fight and they've been fighting all the time. And they decide they're going to resolve their conflict. And they agree that from now on, they're going to be nice. Well, that's very vague. And it's also very unrealistic considering they've been getting on each other's nerves so much. A better agreement might be that they're going to apologize to each other as soon as possible next time when they get upset. But how would you go from that bad agreement of saying, well, we'll just be nice, to something more specific of, okay, we'll give each other an apology as soon as possible after we're upset? You have to reality check the agreement. And when you do that, you try to make sure it's realistic, sustainable, specific, appealing, and updatable. Now, those are 5 features. Again, you can get more information when I send you the tools around, and it comes with a reality check and agreement checklist. So now you have 3 conflict resolution tools: the reflective listening checklist for listening, the positions and needs worksheet for resolving the conflict and starting to get through it, and then the reality check and agreement checklist for working out an agreement. These are tools people can use in practice working through a conflict, and you can also use them to learn a skill. And again, they will be sent around after the conference. We'll work out a link to get you all these tools for free. They're part of some grant-funded programs I've developed that are free for people to use. So that's our introduction and an introduction to some conflict resolution tools. Now, let's talk about self-advocating. And the first thing we want to think about how to do is share our needs, our sensitivities, and our boundaries. So what does that mean? Well, I mentioned I have bipolar disorder. There's things that I need from my support system, from my friends, from my colleagues, in order to have a comfortable life. We all have things that we need. We have preferences, and we have serious boundaries. And the question is, how do we figure out what we need and express those boundaries? So I'm going to go through that. And first, we'll talk about what a personal boundary is. It's a limit or a rule that we set for ourselves. It could be just our own boundary or in relationships with others. A boundary is a vulnerability because we're telling the person something we need, something we can't handle as well if we don't get it. A boundary is vulnerable in that way. A boundary is also a strength because by asserting the boundary, we're empowering ourselves and saying, look, I'm not going to try to hide what my preferences or needs or sensitivities are. I'm going to, assert my needs here and tell you my boundaries. The types of boundaries we can have are physical boundaries, like physical space from someone. Intellectual boundaries, that could be things like what topics we don't want to talk about. Emotional boundaries, to talk about things that we find traumatic, we don't want to engage in. Material boundaries, and time boundaries of how much time we're going to spend on certain topics or with certain people. Time boundaries are a big one in a lot of relationships where sometimes people feel like someone else is monopolizing their time and taking up all of their time. But these aren't all types of boundaries, but these are some illustrations. So why do boundaries matter? Well, first, a boundary can help reduce stressful situations by making sure we don't put ourselves in a triggering situation because we've expressed our boundary. A boundary can help us reduce anxiety because we feel like there's been some way to organize things so that way we don't end up being at risk and we don't have to be as nervous about being put in a situation we don't want. It can be a form of self-protection to avoid experiencing some kind of burnout or being overwhelmed. It can be a way that you can learn to provide better support yourself because, again, you're not burning out, you're not tapping out as much. And it can give you an opportunity to receive support because you're communicating your needs to someone else and they can understand you. So these are some ways boundaries matter. Oh, and it also is a way for us to accept our own limitations. This is an important one for me. It's been very difficult for me in my life to say, hey, I can't do something. I always try to push myself and be in a situation, even though it is difficult. And sometimes, it's been a lot healthier for me in learning these conflict resolution skills to learn to say, you know what, I have needs, I have boundaries. I need something to be done differently. And I'm going to accept that about myself, that I it might be a preference or it might be an urgent need, but I need to do this differently. And I have to stop pushing myself in situations that hurt myself. So working out boundaries can be very positive in that way to realize and make peace with some of these things in addition to reducing all this stress. So I'm going to share a tool with you on boundaries as well. So this is your fourth tool if you're counting. And it's a simple tool to just write down what's within your boundaries, what's approaching your boundaries, and what's crossing your boundaries. So the idea is to sit down and reflect and map out your boundaries. So this is a tool that is the first step in self-advocacy is figuring out what you want. And sitting here and reflecting on your boundaries is one way to do that. Once you know your boundaries, then it's time to think about how to communicate them. It's important to be able to say things that seem simple, but may be hard to say. I need blank. A lot of people don't feel comfortable saying what they need. They give a rational reason for why something might be justified, but they don't say, look, this is what I need. So getting to the point of saying, I need this, and it's firm, and you know you need this, or I can't do blank. Instead of saying, oh, I don't think I can do that. I'm not sure if I'm free. I don't know if I could handle that. Becoming more definitive and clear and expressing boundaries and limits is helpful. And you might say, I need blank because I can't blank. And you get firmer. And so by mapping your boundaries, you might be in a better position to do what looks like very simple communication, but emotionally might not be so simple, because people are often confused and people are often avoidant of sharing their vulnerabilities. So that's why it's helpful to have some tools to think about boundaries and some ideas about how to communicate them. Then the next thing is, when you share a boundary, it's really helpful to keep it universal. So you want to stress, this is not personal to this one situation, but this is what I do all the time. This is my normal boundary. There's a lot of conflicts where people start fighting, and it seems like they're saying this one other person violated them. You did this. I can't believe you do this. And this has been so hard for me, and you hurt me. That's personalizing. But imagine saying, I really can't handle this in any situation. And it's not just you. It's when I'm in this situation at work, or if I'm in this situation with friends or with a romantic partner. This is my boundary in all those situations. If you can listen to what I just was saying, you can see how it's de-escalating automatically when you take the target off of the one person or one situation you're in and say, gee, this is my general normal boundary. So stressing this is not personal is helpful. And you can only do this if you've thought about your boundaries, because otherwise what happens is people don't even know what their boundaries are until the boundaries are violated. And it's very emotional and very overwhelming. And at that point, it's hard for them to realize, you know what, it's not just this other person who happened to violate my boundaries. This is my general, not non-personal boundary. It's a general thing. Similarly, it's helpful to not say any judgments, criticisms, or attacks on the other person. You can do that if you're going to have a conflict and you really feel violated. I'm not saying you can't do that, but if you really want to communicate a boundary, just saying simply, I need this. This is what I need. I can't do this. This is something I generally say to everybody. I can't do this and I need this. And it doesn't have anything to do with any judgments or criticisms or attacks on you. This is just the way the world is. This is just my boundary. This is for me. It's not about you. This is about me. So that can be very helpful as a way to express a boundary. And you can share examples of how you have this boundary with others. So I just modeled that a little while ago. You want to make sure your boundaries are authentic. So what do I mean by that? Well, one classic example is I've done a lot of mediations with families where sometimes parents who are working with maybe a child who's at home with them, an adult child, so an adult person, I shouldn't say, an adult who's living at home with them, say, I'm going to stop financially supporting you unless you do this. Well, unless they really mean it, that they're going to stop financially supporting them or whatever it is, then it's just an empty boundary. It's not real. So you're just teaching people not to respect your boundary. And so it's important to think about what your boundaries are, so that way you don't make one of those empty threats, and instead you give these authentic boundaries. You want to keep your boundaries consistent, because people will learn them over time. So think through what your boundary is and stick to it if you can, although of course you might evolve them. If you do evolve your boundaries, you might explain the changes. It's important to, if you can, broadcast your boundaries. It doesn't have to be a secret. Let people have a chance to really get to know what your limits are, so that way you are treated in the way you want to be treated. Focus on your personal feelings instead of judging the other person. So we talked about that before with keeping it universal, that it's helpful for you to just say, look, this is coming from me. It's not about you. When a boundary is crossed, you might want to share the impact on you. So instead of saying, look, you agreed to follow my boundary and you didn't, and now I think you made a mistake or you violated this, you can still do that if you want to, but it might be more helpful to say, look, this is how it hurts me. This is why I have the boundary. This is how I got hurt by the boundary being violated. A lot of times people will respond better to hearing the impact than to hearing an accusation they did something wrong. You might want to highlight consequences for them. So you might say, look, I'm not trying to punish you for what happened, but I trusted you to show up. when we had our appointment at 10 o'clock, you didn't show up. It was very stressful for me. It gave me a lot of anxiety. And now I'm not really comfortable making another appointment with you like that. So I'm going to have to do things differently because of the pain I felt at that point. So the idea here is to communicate that the boundary violation caused some kind of consequence. You also might want to ask the other person, by the way, these are my boundaries. What are yours? What are your needs? What are your boundaries? What are your limits? I'd like to have us respect each other's. So again, you're not going to make it about them to attack them, but maybe you can show them, look, I'd like you to respect my boundaries, and I also want to know about yours if you're comfortable sharing them. And remember that we're playing the long game. In any relationship, we're communicating over and over again in multiple interactions. So even if something doesn't go well in the first instance, over time, you might do a better job communicating those boundaries. Okay, so we've talked about the conflict resolution tools generally, and we've talked about how to share boundaries. Now let's talk about requesting a reasonable accommodation, which is an adjustment from a business or a school or an employer, someone who's legally required to welcome someone with a disability, which can include a mental illness. If that person needs something, they may have to do a little bit extra for them if they're asked. So let's go over this. The Americans with Disabilities Act was signed into law by President Bush in 1990. It prohibits discrimination and guarantees opportunities for people with disabilities. It is a federal law, so it applies to the whole country, but the state and local laws can be stricter in some places, meaning that people can have even more protections in some areas. So a reasonable accommodation occurs when anyone expresses a potential disability and asks for help. That is considered a request for a disability accommodation. So I'm going to show you an example from the employment context, but there's other ways you can do this. But if you're at a job and you want to ask for a change, what you have to do is ask for an adjustment of any kind. And you don't need to suggest what you need adjusted. So you can just say, I need something done because I can't sit at my desk for the whole day due to my disability, or I need something done because I can't handle this particular schedule. It could be all kinds of things, but you have to ask for some kind of change without necessarily needing to suggest an option. And it has to be for a reason related to a medical condition. Now, when you ask, you can do that at any time. You don't have to let them know as soon as you go to the job. You can ask it any day, any moment. Ideally, someone would ask it early to prevent problems, but they don't have to. So no one should feel ashamed if you decide, I don't want to tell somebody I have a mental health problem, but one day maybe I'll change my mind and tell them because I need something changed in the office and no one's making the change. You can ask it in plain English. It can just be done verbally. It doesn't have to be written. You don't have to use the phrase reasonable accommodation. An example request is, I'm having trouble getting to work on schedule because of medical treatments. So what might that be? It could be going to a psychiatrist or a therapist or some kind of mental health program or something for your mental health that interferes with your work schedule, and you're asking maybe I'm going to want my schedule changed. So just saying this technically would be an accommodation. I'm going to show you a way to ask it more fully, but that's one example. I need time off because I'm feeling depressed. So that might be another request because we see the person needs time off and they say they're feeling depressed. Now, one thing to note about this is you don't know if the person has depression. You don't know if they qualify for a disability or they're just saying they're depressed. And so, if you're an employer, you want to be sensitive to noticing these kinds of things. If you're the person asking, you might want to just be clearer about whether you have a disability or not, but I'm going to show you what you need to say. If you say, I'm feeling really depressed, it's not an accommodation request because you're not saying you want anything changed. Likewise, I go around all the time and tell people I have bipolar disorder. That doesn't mean someone should treat it like I'm asking for help. You have to have both pieces where you say you have a possible disability, and then you say you want help. Now, some things people ask for at work include making facilities accessible, taking a leave of absence, telecommuting, restructuring jobs to change some of the functions that are not as important and have them removed, modifying schedules, changing policies and trainings. There's a number of different accommodations, and you can learn about them at the Job Accommodation Network if you want to see some examples. But basically, you're allowed to ask for anything that you need adjusted based on having a disability if you need it for your disability. And there's a sample request letter. So this will be the 5th tool that I'm going to send around, is the sample letter from the Job Accommodation Network, which has a lot of resources for seeking reasonable accommodations. And in their sample letter, you identify yourself as a person with a disability, and you ask that you're requesting an accommodation. You identify your specific job tasks that are causing a problem. Share any ideas you might have for an accommodation. You don't have to. Request the employer's ideas and give them any medical documentation you want to give them, and ask that they respond to your request as promptly, in a reasonable time. So that's how it would look like if you're going to do it by the book. And the employer can answer through a formal memo, but they don't have to. They can't ignore it, but there's no specified time limit. They should explain if there's delays. They can ask for some kinds of medical information. At this point, if that's happening, you should look for legal advice to understand and not, share too much about yourself if you don't want to. And they can suggest alternative accommodations to meet the need. I want to highlight that there's ways you can make less formal requests. You don't have to tell someone. First of all, you can always ask for anything you want at work without telling someone you have a disability. And hopefully they'll give it to you at work because they want to be accessible. But if they say no, that's when you can say, well, wait a minute, I'd like to do a reasonable accommodation request. So less formal requests are always, in my opinion, the ideal. And then you can bring in the reasonable accommodation request if people didn't bring it up. And again, people can email me with questions about this. It's dan@mhmediate.com. I'll show it to you again at the end. I'm going to skip over this slide just for timing about seeking an accommodation, because I know we're getting close to the end of the session. I want to make sure I cover everything. So the next thing we have is about seeking information. I'm just going to give you a quick nod to say, a lot of times records are created. So in my life with bipolar disorder, there were records created about me at my school when I had a manic episode and wound up having a leave of absence. So my school had records of that. There's records that my clinicians have that are documenting my care and patient notes. There's records that are happening all the time. Sometimes people might want to get that information. That's a self-advocacy process as well. And we don't have time to go into it now because of the scheduling issue that we had. But if you're interested in learning more about requesting records, you can email me at dan@mhmediate.com. And again, I'll show that to you soon. So the last thing I'm going to show you is confronting microaggressions and discrimination. In terms of microaggressions, there's a guide to responding to microaggressions. It's very helpful. I'll provide a link to that when I send the tools. So if you're counting, this is tool number 6 that you'll get after this program. And in this guide, first, they teach what a microaggression is. I mentioned to you, it's a comment, a remark that contains some kind of implicit, implied message against a person's identity. It can be racial, it can be gender, it can be LGBT, it can be religious, it can be intersectional. That's how this guide works. This guide doesn't talk about disability and mental illness, but it also can be disability and mental illness. And there's entire bodies of research on that. Now, what do you do when you have a microaggression? Well, first you ask yourself, did this really occur? Because sometimes it's hard to tell. Should I respond to it? And how should I respond to it? So this guide will walk you through these steps. And in asking yourself if you should respond, the questions include, if I respond, could my physical safety be in danger? If I respond, will the person be defensive and could I have an argument? If I respond, will this affect my relationship? So the person made a comment and you try to tell them it's stigmatizing. Maybe now they're upset that you said something. So a lot of times people might not say anything because they don't want to feel in danger. They don't want to have to lose a relationship or have someone be defensive. But on the flip side, if you don't respond, you might regret not saying something, or you might be setting yourself up to accept more stigma because you didn't say anything about it. So it's very tricky. And I'll send this guide to you, and I'll also send you a link to a new project that I'm developing to help people who have experienced stigma seek mediation to help them talk through it, because this is such a tricky question. How do I speak up about stigma without offending the person? How do I go on and endure the stigma if I don't say something? So it's a very tricky situation. And one of the things I've done in my work is I've been trying to give people tools to address this stigma. The other thing I wanted to talk about as an example here is discrimination in publications. So it's a little small, but if you look at this chart, you'll see a funnel that starts by saying, look, there's a lot of people who have stigmatizing attitudes and beliefs. Sometimes that becomes a microaggression. Then some other times it becomes discrimination. And at the bottom of the chart, maybe sometimes people will publish discrimination. Now, I mentioned I'm a mediator. In the mediation world, I've been reaching out to law schools, professional associations, big industry websites that have written guidance that tell people to discriminate against people with mental illness and assume that their symptoms are made up, assume people are more violent, turn them away if they are not taking their medications, guess about their symptoms and what to do, treat them differently if they have a condition. All sorts of things are just written out there, published. And it's really sad. So I started contacting them to ask them to fix it. And it's been a big project, which again, I'll share more when I send the tools after the program. But it's, that's another area where you might think about speaking up about discrimination. And I just wanted to quickly show you what I've been doing when I contact these places, because I've actually gotten some of these law schools to change their documents or remove them or update them. So first I tell them, look, there's a problem. I see a problem in something you've published. I reach out and let them know. Then I say, you're not alone. This happens all the time. And I educate them and say, look, a lot of people have stigma with mental illness and it's unconscious and they don't realize they're doing it. And my outreach to you isn't just about you. So again, I'm not making this personal. It feels personal, but there's other people I'm contacting too. And, all of these people have a problem. It's not just you who made a mistake. So I'm trying to make them more comfortable. And I tell them, people are reading this every day, so you should act now that you know. So I try to give them some sense of urgency. And then I ask them, what can you do about it? So I'm trying to listen to them. We discuss their ideas. I stress that I'm a mediator and I'd like to collaborate. And I say, you can do whatever you want. If what you're doing isn't great, I'm going to talk to other people about it because it's just published. It's not a secret. So a lot of times people will try to drag their feet, and I'll say, I'm going to write about this. I give conference workshops like this one I'm doing now, and I might talk about it. And I let them also know I'll pursue advocacy recourses, but stay open to dialogue. So some of these people immediately took down their documents that said something like people with mental illness are violent, or people are using their mental illness as a bargaining strategy. And some other people tried to ignore me. And so I did things like contact their institution and file a grievance, or speak openly about the fact that there was a problem in their materials. So that's a little bit advanced for what we're talking about today. But if this is interesting to you, you can email me at dan@mhmediate.com, and hopefully we'll get those tools to you and you'll hear from me that way. And if you know any instances of stigma, you can tell me, because I've been contacting a lot of people to address it. And the hope that I have is that you can see there's a way to speak about this using conflict resolution skills that might be more effective than the standard way we complain. And I've been finding that I have had better results because I offer to dialogue and use conflict resolution tools instead of just doing the advocacy stuff I normally would have done. So at that, I'm going to leave it at questions and give you my email address. I'll leave this up for you guys. So I haven't seen any questions come through. We've got about 6 minutes left. So you can email me at dan@mhmediate.com. I will look at the chat to see if there's a question. Here we go. Any suggestions on talking to employers or managers about boundaries when the reason for the boundaries often used as a broad catch-all? So I have anxiety and depression. Any language suggestions, because people say X gives me anxiety casually. Okay. I'm not sure from this question. So I know there's a delay. I'll probably be talking for more than 30 seconds. So if you can clarify what, my question to you is, are you saying that you're having trouble explaining that you have anxiety that should be honored? Or are you saying that you're the manager and you don't know if you should listen to someone who says, whoever, whatever gives me anxiety casually. If you want to weigh in and put that in, if anyone else has more questions, put them in while I'm talking because there's the delay. Happy to do it. But basically, there's a big question of what do you do when people use casual language about something gives me anxiety. Now, the truth is, if you're really looking at it, that is a request for reasonable accommodation in the workplace. But people often overlook it, where that because of the fact that a lot of people do get casual about mental health situations and don't treat it the same way as if someone said a physical health situation. So my advice for an employer would be to take every time someone says something gives them anxiety seriously and check in and follow up as if it's a request for reasonable accommodation. If the person is asking and they're saying no one's listening to me, right? If you're the employee and you're explaining the anxiety, my advice is that as the employee explaining the anxiety, to say, hey, just so you know, this is a reasonable accommodation request because of my anxiety, if you're finding that they're not listening. So basically the way it works is hopefully nobody ever has to make a reasonable accommodation request. Hopefully all the workplaces are going to become very sensitive, and it's called accessible. And they'll listen whenever anyone makes a request, and you won't need to tell someone, I have a disability. That's the best, because then you don't have to go through the disclosure. So it's a personal choice if you want to disclose further. But if you're already trying to disclose your anxiety to get some kind of help, then one thing you might try to do is say, look, I'm asking you this as a request for a reasonable accommodation because I have, a health condition of anxiety, or, if you don't want to say disability. So that might be an opportunity where, you clarify that. Now, theoretically, they should already know that, but most people don't. Most people don't understand. And so they need it more spelled out. And if you're going to advocate for yourself and say, look, I asked them to make a change, they didn't make the change. I have this, disability need, and I really need the change. Then at some point, you're going to have to get specific just to make that claim and say, look, they didn't honor my disability request. So at that point, you might as well get specific. I'll give you an example. One of the places that I tried to get the articles changed stopped speaking to me when I told them I have bipolar disorder, I'm emotional, I have emotional regulation problems, and I don't want to meet you on Zoom. I want to do email. So they stopped speaking to me at that point. And then I contacted somebody else at their office and said, somebody stopped speaking to me. This is a disability request. I'd like you to honor it as a disability request. So that, and it's still, unfortunately, in that situation, it still hasn't gone as well as I would have hoped. But the point is, you might consider getting more specific with your language. And if you want to ask me more questions about it and discuss it more, email me at dan@mhmediate.com. I really, anyone should email me. I hope to hear from you. I will make sure everyone gets the tools. I'm waiting to see if anyone else has more questions to share. And I thank whoever complimented me on these skills. I've been working for a while to collect these skills because I want to be able to share them with everybody and give them to people in these tools. Someone wrote, I have seen reasonable accommodations have been retaliatory. Please contact me and share more about that. Email me at whoever wrote that at dan@mhmediate.com. I would love to talk to you and learn more about that. Because I'm doing a lot of work about helping people ask for reasonable accommodations. And so if people have retaliated or seen them as retaliatory, I'd like to learn about that. If you're comfortable, please email me at dan@mhmediate.com. Somebody wrote, at my university, having a documented disciplinary record is required as a faculty member to grant an accommodation. What you're saying is different. Are you not in compliance with the law? No, at your university, so what I'm saying is, each place has their own requirements for doing a reasonable accommodation. What's happening is people should be referring students at your university or staff to HR to go through the process of getting an accommodation whenever someone makes a request the way that I said. A lot of times people only respond to those requests when they're formal. So you are in compliance with the law most likely at your university. I'm not going to give you legal advice on that or not, but a lot of people wait for a formal request. Now, a lot of employers will require, once a request is made, that there be documentation. That is not because they're obligated to have the documentation, but it's because the documentation becomes a way to check if the person has a qualifying disability, and to argue with what the person's asking for, because maybe the university wants to provide something cheaper than what the person's asking for. So a lot of places have extra documentation within their rights of what they can do to examine the request. And that's why at your university, they must say, we won't honor a request unless it's documented on record, and we do this for everybody. So that's my guess. You can, again, anyone can email me, dan@mhmediate.com. I see Gertie coming back on, so I know we're wrapping up. So again, please email me, dan@mhmediate.com. And everything I said is not legal advice, but I just want to say again, all someone needs to do is verbally say, I have a medical need and I want something changed. And that is technically a request for an accommodation. So all employers, all places should hear that and then follow whatever their process is. So whoever said this documentation process, they would follow that. And a lot of places do it informally. So when I go to a hotel, I'll tell them I need a low noise room and I have a disability, and I'll tell them more information if they want. But you have to give me the low noise room before the other guests, because it's a request for reasonable accommodation. And sometimes I have to educate them, but normally what they do is they don't care. They don't ask for any documentation, and they give me the room. So that's an example where you don't have to be documented. It depends on who you're asking and when you're asking. A lot of employment situations and schools will make sure everyone has to fill out documentation in order to get the request, because they want to have a standard process to check and possibly not do the accommodation. And with that, thank you, everyone. My email's still up, and here's Gertie.
Dan, thank you so much. You've given us so much information and so much things to think about in acknowledging and recognizing conflict resolution and our own self-advocacy that we need to stand up for. Extremely great information, and thank you. If anybody else have a question, you can put it in right quick. I'm just going to give you the last little verbiage that I need to say. If you're looking for CEUs from this workshop, you'll need to fill out the survey. That's important. And then be sure to check out NAMI Land and other amazing virtual resources in our virtual exhibitors hall. Don't forget to participate in our resource scavenger hunt. If you find all the resources listed and submit your answers by the end of the conference, you'll be entered in a raffle to win a DSW messenger bag. So I see there's one more question.
Yes, I'm happy to answer it. So
okay.
Somebody wrote, I asked for reasonable accommodations to have the air quality in my building tested because of my respiratory disability on oxygen, and the GSA building people took over from my agency and denied it. How could I have gotten what I needed? So we haven't had time to go over all kinds of self-advocacy, but you can imagine if you have an insurance company, your medical insurance, sometimes they deny claims and you have to advocate for yourself. There's a lot of situations to advocate for yourself. So in this situation, I don't know your particulars. Again, you can email me at dan@mhmediate.com. I'm not an attorney, but I'll try to help you and share more information. But usually when someone turns down a reasonable accommodation, they will do so because they think the person is not covered. If they check the disability and say, we disagree, we don't think you qualify as disabled, or they will say it's an undue hardship to do this work. So it's too expensive. So for instance, with my example for the hotel, I tell them you have to give me another room because you have the rooms. It doesn't cost you anything to give me an extra room. So I know it won't be an undue hardship, but I wouldn't be able to ask them to build me a new room. Because so there's different ways, and there's a couple of other ways someone can turn down a reasonable accommodation. So I'm happy to talk to you or anybody, dan@mhmediate.com. Everyone save that email address for the rest of your life. You can email me, I will answer you because I really am committed to this work. But for the person who shared this example, I'm happy to talk to you more about possible language one might use when responding to a denial to maybe get them to change what they're doing. because a lot of times, things don't get done right. And there are enforcement challenges with the Americans with Disabilities Act. And unfortunately, a lot of people in the mental health context get ignored. So there's actually data that shows that if you have a request for a reasonable accommodation or other things, you're least likely to get it if you have a mental health situation as opposed to another kind of disability. But there's a lot of challenges for all kinds of disabilities. And I believe that it's not right that there's all these challenges, but maybe some of these conflict resolution skills can help give you an edge in asking. And so this was just the beginning of these skills. I have a lot of these skills. I'm working on ways to package them. Email me, share feedback, share questions. I have more resources. If you have any situations, I'd love to hear them, because I learn too from hearing your situations and trying to give you the tools. So thank you all very much. I really am glad you all were here, and looking forward to sending out these tools soon.
Great. And thank you, Dan, very much. And thank you everyone for joining us. And I think this was our last workshop. So thank you for joining us for this 39th annual conference.